to obstetrical, uterine contraction and uterine bleeding. Early postpartum period, first 24 hours patient in the room, discharged from delivery room, were controlled by midwife who knows every hour during 24 hours. If absolute healthy, some clinic patient can be discharged. In our perinatal center, 3-5 days later. Late postpartum period, it's 6 weeks, 42 days. Postpartum disease that occur in the postpartum period from the time of birth to the end of 6 weeks after delivery or during 24 days, associated with pregnancy and childbirth. So associate with the pregnancy and childbirth. It's postpartum. If patient had abortion with the fetal weight less 500 grams, it's not postpartum period. It's period after miscarriage. Classification. According to time, according to etiology and risk factors. Examiner question 2. 2 classifications. First, during pregnancy, during labor. Ready? And obstetrical complications. Obstetrical complications for your all futures practice. 3 main complications. Associated with postpartum, not associated with postpartum, but all of these complications we should keep in brain if patient has disorder associated with pregnancy, porphyrium, bleeding during pregnancy, placenta abruption, right? Postpartum it's 5D, да? Что у нас? Tissue, next. Thrombosis, next. Trauma, next. Tonus, and 5th T, treatment. 5T, да? Septical complication associated with infection and activate later than 24 hours, doctors, not early, later than 24 hours. And eclampsia only 1 week, 5-7 days. Obstetrical causes, mammary gland disorder, lactostasis mastitis, and genital organs disorder, uterine, cervical, and vaginal disorder, uterine endometritis, cervical cervicitis, vaginitis, not isolated vaginitis, vulva vaginitis. Non-obstetrical causes, stretch marks, hemorrhoids, constipation, urinary or stool incontinence, hair loss, postpartum depression, discomfort during sex, difficulty regaining pre-pregnancy shape. Septical complications of postpartum period. Continue classification. Local or general forms. By localization, it's anatomical classification, perineum, body, cervix, vagina, uterine, ovaries, parametric tissues. Third one, by pathogen. То есть aerobic, anaerobic, fungal, sexual transmitted disease. And fifth, doctors, what are the fifths? Mixed infection. Fifth is the mixed infection. Gram-positive. ABD aerobic group streptococcus, enterococcus staphylococcus aureus, and gram-negative Escherichia coli, Klebsiella protei. Escherichia coli, Klebsiella protei. Not only one, it's usually mixed. No, one of these will be the first and activate other infection activity. Anaerobic, peptostreptococcus, bacteroids, clostridium, fusobacterium, ada, chlamydia, mycoplasma, chlamydia trachomatis, mycoplasma gomitis, mycoplasma genitalium, что еще мы знаем, герпес, да, genital herpes, что еще, trichomonas, gonorrhea. Doctors, this classification demonstrate the steps of infection. Sazonov-Bartels classification. Dr. Sazonov and Dr. Bartels classified postpartum classification. So it's classification number 6. Да? Number 6 classification. Laceration of perineum body, puerperial ulcer. Endometritis, location only in endometrium, only in mucosa. Patient without complaints, only pathological discharge. Postpartum endometritis, imbibition the uterine muscle by the fluid blood of infection, and patient feel pain, low abdominal pain. Postpartum endomyometritis, pain plus pathological discharge. Postpartum panmetritis, signs of Schoeking-Blumberg, signs of peritonitis, pelvioperitonitis, peritonitis, and postpartum metrothrombophlebitis, то есть clots in the veins, femur veins, uterine veins, and patient feel severe pain and asymptomatic, neasymptomatic, asymmetrical edema of the legs. But now we can see 1, 2, 3, 4, 5 steps, not one by one. It can be primary postpartum metrothrombophlebitis. Doctor miss previous steps of infection. If infection up, continue. Postpartum pelvioperitonitis under the inlet plane of the pelvis. Uterine, urinary bladder, colon. Diffuse peritonitis above inlet plane, it's surgical complication. Septic shock, common complication. And mastitis with or without genital organs infection. And pneumonia is extragenital classification. In this picture, we can see non-genital, urinary bladder, it's cystitis, urethritis, но здесь мы видим, что this male, male urethra prostate we can see. Wound infection, local infection, and the scar infection. Episiotomic wound infection and cesarean section wound infection. That is why we should keep in brain all doctors' operative maneuvers increase risk of infection in 40 times. That is why natural labor is the better than operative. Attention, students from Brazil. In Brazil, rate of cesarean section 70. It's not good. It's highest in the world. In Moscow Perinatal Center, 30 is maximum patient with severe pathology. Other septical complication of postpartum period: wound infection, adnexal infection, pelvic abscess, tubo-ovarian abscess, pelvic peritonitis. Смотрите. It's not good. It's pathology. Mother should stop breastfeeding and think about baby, but it's impossible. Mother has severe pus infection. Thrombophlebitis, ovarian vein thrombophlebitis, metrothrombophlebitis, septicemia. 1, 2, 3, the first, it's vein infections. It's result of endotheliitis. What's preeclampsia endotheliosis, infection endotheliitis. And blood cells collected, fixed on endothelium and formate the thromбs. And thromбs can stimulate infarct, insult, by septical embol. Septic shock and late complication, infertility. So this pregnancy single, other pregnancy impossible. Patient has highest risk of infertility. Итак, let's write the international definition of infection. Postpartum infection is symptoms during the first 10 days after childbirth, with the exception of the first 24 hours. Body temperature for 2 consecutive days reaches 38 Celsius when measuring temperature at least 4 times a day. More than 38 during 2 days, during first 10 days, да, except first day after labor, and measure 4 times. It's not single time, да, if second, third time normal blood temperature, it's normal. If first day more than 38, it's normal. What if second till 10 days, this is sign of infection. Так, сейчас мы с вами посмотрим видео. Давайте посмотрим. Так, is here a year leader, doctors?
Yes, madam.
Ага. Когда мы будем с вами проверять? When we'll check who is here?
Madam, all the leaders have sent me attendance. I have marked
Ну хорошо.
already.
I hope it will be real.
Yes, ma'am.
Потому что это вам. Need to you, not to me, да? Так,
Yes.
так, давайте сейчас мы посмотрим видео с вами. Doctors, do you see?
Yes, ma'am.
Ага, ну давайте посмотрим. Продолжаем с вами. Let's continue. Doctors, do you see presentation?
Yes, ma'am.
Yes, madam.
Хорошо. Итак. What cause of infection? Is it iatrogenic? Can doctor give to patient put into the uterine cavity infection? No, some people think it's the doctor's cause, it's iatrogenic. Really, patient had infection before pregnancy start. Non-married sexual activity, mixed partners, or patient has chronic extragenital pathology like chronic anemia, chronic pneumonia, chronic pyelonephritis, chronic cystitis, vaginitis, vulvovaginosis, and the pregnancy start and phone of this pregnancy with the many microorganisms. In this picture, we can see infection during pregnancy. Infection during pregnancy called intrauterine infection or intraamniotic infection. Insemination infection of the product of conception. Infection like swimming in amniotic fluid collected between amniotic sac and endometrium, and fetus will drink this amniotic fluid, discharge, and be with the microorganism, and that is why what result will after labor? Baby sick and mother sick. Baby will have postpartum pneumonia, skin disorder, pneumonia can be as virus as mixed pneumonia, and mother can have intrauterine infection or endomyometritis or panmetritis or septic shock. In this picture we can see septical abortion. This case finished by hysterectomy together with the product of conception. And second picture, we can see chorioamnionitis by twins, abnormal placenta. Please copy this picture, doctors. Copy this picture. Risk factors for puerperal infection: endometritis before pregnancy, urinary tract infection, atelectasis or pneumonia, wound infection, septic pelvic thrombophlebitis, mastitis. Emergency cesarean section, да, смотрите, prolonged rupture of membranes, prolonged labor, multiple intrapartum vaginal examination, intrauterine manipulation. All of this increase risk of infection in the uterine cavity. And result after birth, endometritis. How we can correct this? Cesarean section only in plan, correct conduct vaginal labor per vias naturalis. If patient had amniotic fluid discharge before hospitalization, more than 6 hours, or 6 hours later, we should give antibiotics during labor. Multiple intrapartum vaginal examination, only 3 times during labor, doctor can use vaginal examination. Intrauterine manipulation procedures, manipulative procedures, not good, but sometimes impossible without intrauterine manipulation. Conduct the third stage labor, placenta accreta percreta, or risk of uterine rupture, doctor should check uterine cavity. So last cause of endometritis we can't prevent. And the other doctors.
Madam, your screen is not changing.
Что?
The screen is not changing.
We need not see that.
No, ma'am.
Do you see risk factors for puerperal infection? Таблица.
No, madam. We can only see
Да.
septic
Что
abortion
ж такое
pictures.
сегодня? Сейчас попробуем еще раз. Что ж такое? Ну, давайте вот так попробуем. Сейчас я... Ага. Доктор, do you see таблица now?
Yes, madam.
Сделайте, пожалуйста, скриншот. Please do screenshot. Attention for first column. Есть? Готово? Ready?
Yes, ma'am.
Хорошо, дальше. Risk factor, doctors. It's absolute different. Risk factor and etiology. Etiology 100% infection start. A risk factor 50-50. We can correct. Do you see the slide risk factors?
Yes, madam.
Do you see or not?
Yes.
Yes, ma'am.
Хорошо. И смотрим, что эпизиотомия, only risk, да, it's doctor's procedure, it's small operation. Manual removal placenta, not absolute, да, cause of its risk factor. Instrumental delivery, forceps, vacuum extractor. Multiple vaginal examination, да, то есть not absolute, but we can prevent decrease risk of intrauterine infection if not use, ну, as possible, да, not used all of these procedures during labor. Symptoms of puerperal pelvic infection. Ну, посмотрите, please read these symptoms. What the first of the symptoms, what do you think? Что это? Диарея, fever, headache. Как вы думаете? What do you think? Symptoms of puerperal pelvic infection. Как ответить на этот вопрос? How we can answer the question? What symptom the first? More important symptom. We know 3 signs of puerperium, да? Doctor should check. Uterine size, structure, soft or hard, да? Small or big, то есть uterus. Second sign, lochia, rubra, serosa alba, and third sign is, what third signs? Mammary gland structure, right? What 3 signs demonstrate is the puerperium normal or abnormal. Значит, very important discharge and very important uterine, что according uterus, what is called abdominal discomfort and discharge postpartum hemorrhage or past discharge. Да? Ну и mammary gland is lactostasis or mastitis. Signs. Посмотрите. Not absolute specific for postpartum, да, it's signs of septical complications in different organs. If these signs present, temperature not higher, not every time more than 38. Вот, ведь не перитонайтис, а перитонизм. Значит, we should check where is the infection, in the uterus, in the vessels, in the mammary gland, or abdominal peritonitis. То есть anatomical classification Barto sites. То помните steps of infection? Vulvitis, vaginitis, cervicitis, endometritis, endomyometritis, да? Дальше что у нас будет? Илиайтис или что там? Фимур, винс, тромбозис, да? Pelvioperitonitis, peritonitis, and adnexal mass, да, adnexitis, salpingitis, oophorytis. Sazonov, Bartel's steps. We should check all of these steps and find localization of infection. And we know Latin proverb, где гной, там режь. Where pus, we should cut. We should cut and drainage if pus collected in that organ. Or uterus, we can store drainage through the cervix. Method of diagnosis. Breast condition, abdominal structure, Schocken-Blumberg, positive or negative, uterine structure, and lochia discharge. Abdomen and uterus together. Attention, stop from mammary gland, from the cleanest part till infected part. Да? Breast condition, palpation of abdomen, palpation and find the uterine fundus, and check the patient lochia. Так, сейчас мы посмотрим следующий фильм. Let's check the next movie.
The postpartum period is all about change. As your body heals and you grow into your new role of being a parent. In this chapter, Understanding Postpartum, you'll learn what to expect during the first few weeks after birth, including your immediate postpartum recovery, tips for making the transition home easier, and important breastfeeding information. Let's start with your hospital recovery in the first few days. I wanted to come and see you. Congratulations. Kara had a vaginal birth yesterday. Her midwife checks on her to assess the healing process so far.
So, how do you think your bleeding has been doing? Is it tapered off a little bit since from what it was yesterday?
Yeah, I mean, for the few hours after, there was a fair amount,
Mhm.
and then it slowed down, and then it kind of comes back.
Right after birth, your uterus starts to get smaller and continues to shrink for about 6 weeks until it reaches its original size. This process is called involution. During involution, you might feel mild to moderate contractions called afterpains.
I'm just going to gently feel for where
The midwife feels the position of Kara's uterus to make sure it's smaller and firmer. Breastfeeding speeds up the involution process, so don't be surprised if you feel more afterpains while you're nursing. The same relaxation techniques you use during labor and birth can also be used to cope with these mild contractions while breastfeeding.
Так, хорошо. Хорошо, так. Сейчас у нас еще есть очень хороший фильм.
The postpartum period is all about change.
Doctors, do you see?
Yes, ma'am.
Doctors, do you see video?
Yes, madam.
Ага, давайте посмотрим.
No part of your body is harder hit by giving birth than your vagina and breast. In the several days following birth, your breasts will produce a yellowish fluid called colostrum.
In the several days following birth, your breast will produce a yellowish fluid called colostrum. When your infant suckles, it will cause the release of hormones that trigger your milk. However, even if you choose not to nurse, your breast will produce milk for several days to a week. If you want the milk to stop flowing, you shouldn't allow your baby to nurse, nor should you remove the milk in any other manner. As your breasts inevitably get swollen, you can use cold compresses to ease the pain. There are medications like bromocriptine or high doses of injected estrogen, which can suppress milk production. However, these drugs come with additional health risks to the mother. They are not commonly prescribed. You will notice discharge, known as lochia, from your vagina. This occurs as cells from the lining of your uterus slough off. Lochia starts out as bright red blood and then tapers off before finally stopping. After you give birth, your uterus is 15 times heavier than it was when you got pregnant. For this reason, you'll be able to feel a few finger widths below the top of your belly button. But by 6 weeks after delivery, your uterus will return to its pre-pregnancy size. Having a baby definitely changes your body, but take comfort in the fact that most alterations are only temporary.
Just 1 minute. Так, сейчас мы с вами попробуем вернуться. Мы возвращаемся. Нашей презентации. Еще есть, доктор, Джизода Л.